Assalamu alaikum my dear students. Once again welcome to my YouTube channel by the name MS Lectures, and today I will be demonstrating about the very important topic of the biochemistry, which is the respiratory alkalosis. So in previously I have demonstrated you about the respiratory acidosis, where you can say concentration of the carbon dioxide gets elevated, but in the case of the respiratory alkalosis, the concentration of the carbonic side and the carbonic acid, you can say, goes very low beyond the normal, by the normal, sorry. So H2CO3 concentration drops low by the normal. So this actually causes the respiratory alkalosis. And now I would like to tell you about its causes. Like what are the causes which are, you can say, contributing in causing the respiratory alkalosis. So first cause, it is the hyperventilation. Then altitude, then anemia, then increased intracranial pressure, so now I will be telling you about these causes in detail. So hyperventilation. So whenever during the stress conditions, or whenever the body is in shock condition, the body tends to, you can say, breathe more, our body tends to breathe more deeply. So this actually leads to hyperventilation. So in hyperventilation, what happens that the person try to breathe very deeply. So during this, you can say, deep breath, what happens that he tries to inhale more oxygen in, and then you can say try to exhale more carbon dioxide out. So during this hyperventilation process, you can say the amount of carbon dioxide decreases, you can say, very much low. So amount of carbon dioxide gets very much low, which actually leads towards the respiratory alkalosis. Furthermore, in the altitude case, the person, the condition of the person is in the state of the hypoxia. So the person tries to breathe more, deeply, which actually you can say leads to the decreased concentration of the carbon dioxide, as he tries to breathe in the oxygen more and tries to expel the carbon dioxide more in the concentration. So after this, in the case of anemia, also the person is suffering from the lack of oxygen, so he tries to breathe more oxygen in and tries to expel more carbon dioxide out. So this also leads to the respiratory alkalosis. And furthermore, talking about the increased intracranial pressure. So what causes the increased intracranial pressure? So what happens that in our brain, the amount of cerebrospinal fluid increases, which actually builds up the intracranial pressure. So when the intracranial pressure is increased, the amount of blood reaching the brain tissues gets decreased. So if the amount of blood is not reaching the brain tissues, so what would happen that particular brain tissue would be suffering from the lack of oxygen. So during this, what happens? Our body tends to increase the heart rate. So heart rate is increased, respiratory rate is also increased. So heart rate also increased, respiratory rate is also increased. So this would actually, the body will try to increase that arterial blood pressure more than the intracranial pressure, because the body main goal is to provide the brain tissue oxygen. So this would actually, you can say, leads to the decreased concentration of the carbon dioxide, and you can say the effort to deliver the oxygen towards the brain tissue, despite the increased intracranial pressure, leads to more oxygen concentration in the body, and this is also that's why this is also the contributing factor in causing the respiratory alkalosis. At the last, there is a treatment of this. So by the help of medications, what kidneys do? Kidneys actually expel the excessive bicarbonate ions, from the body. So the expulsion of the excessive bicarbonate ions actually again brings the body back into the normal conditions. So this is the whole lecture about the